Good afternoon, everybody. This is Congressman Mike Levin. Welcome to our latest virtual town hall on the coronavirus. I'm very honored to have you join us this afternoon, whether you're watching on Facebook, Twitter, YouTube. We're grateful that you're here. And I'm always grateful for my amazing team that helped put these virtual town halls together, as well as Jeremy, who's doing the video conferencing today. We're very grateful for all of you. And I'm also very, very grateful for our friend, Dr. Richard Garfien, who joined us again today. He is an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. Dr. Garfien earned his PhD at Johns Hopkins University and his MPH at San Diego State University. He served as an epidemic intelligence service officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention in Atlanta before joining the faculty at UC San Diego School of Medicine in 2005. Dr. Garfien's research focuses primarily on airborne and bloodborne infections, often associated with health disparities and substance use, including tuberculosis, HIV, and viral hepatitis in the United States and abroad. His research on digital adherence technology over the last decade informed CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Such technology obviously is of relevance today as we consider the impacts of telehealth and COVID-19. Dr. Garfien, great to see you. Thank you, as always, for joining us.
You too, Mike. Thanks.
So over the next 90 minutes, we're going to cover some of the latest public health questions around coronavirus, as well as some of the latest going on the policy front. As always, we'd be honored to have your questions, and you can ask a question or make a comment by commenting on the live stream or by emailing us at townhallquestions@mikelevin.org. Again, that email, townhallquestions@mikelevin.org, and we'll try to get through as many of these questions as we can. We've got a ton that were submitted in advance of this town hall, and we're very grateful for all of those. As always, the number one thing that we can do to prevent the continued spread of COVID-19 is to follow the guidelines from the Centers for Disease Control and Prevention, as well as from our state leaders and our local leaders. We've got to do all we can to flatten that curve. And I wanted to share, as we do every week, some updated numbers, and they are very tragic, as we know. The United States has the most confirmed cases of coronavirus in the world by far, with approximately 718,185 and 37,730 deaths. California has confirmed 29,839 cases and 1,064 deaths. San Diego County has confirmed 2,158 cases, and Orange County has confirmed 1,556 cases. There have been 70 deaths so far in San Diego County and 32 in Orange County. And of course, these are so much more than statistics. Every single one of those who has suffered from this disease, and tragically, those who have lost their lives, their loved ones, their family members, their friends, know the impact of COVID-19 on our communities all throughout the United States. And our hearts are with every single family, every single loved one who's been impacted by this crisis. The University of Washington Institute for Health Metrics and Evaluation, or IHME, is continuing to project that 60,308 Americans will have died of COVID-19 by August 4th, 2020. According to that model as well, of those 60,000, 1,658 of those deaths are projected to be in California, and peak hospital resource use actually was this past week, according to the IHME model. So there are encouraging signs in that those numbers have declined a fair amount, even from a couple of weeks ago, in terms of the expected cases and the expected deaths as a result of COVID-19. The California Department of Public Health continues to suggest that early to mid-May will be the peak in California, so there is a bit of discrepancy there. And I'm on the phone virtually every day with Orange and San Diego County public health officials. And we believe the situation is a bit better here locally, though we still have to do so much more in terms of testing that we'll be talking about in just a minute. Right now, as I've said, every week we're facing two simultaneous crises in our country. We're facing a public health crisis and we're facing an economic crisis. And the best way to deal with the economic crisis is to tackle the public health crisis head on. In other words, you cannot have a healthy economy without healthy people. And as I mentioned in our past virtual town halls, Congress has now passed three bipartisan bills on coronavirus. First, on March 6th, we passed an $8.3 billion supplemental appropriation specifically focused on development of the vaccine, as well as research and equipment stockpiles for state and local health agencies. Then on March 18th, we passed the Families First bill, about $200 billion to provide affected individuals with paid sick and family leave and emergency leave, as well as expanded food and nutrition assistance, and free testing. And we still need far more of it, but we began back in March. And March 6th was the first time that we provided additional funding for testing. At the end of March, we passed the third bill, which you're probably familiar with, called the CARES Act, $2.2 trillion, and really aimed at those two crises that I mentioned. From a public health perspective, $100 billion to our hospitals. I've already been in touch with many of our local hospitals who've received some of those funds already and anticipate receiving more funds in the months ahead, weeks and months ahead. $16 billion to replenish the national stockpile. We know that that's a huge issue, and we intended for that money to go to the states and the frontline medical professionals who need the supplies the most, whether it be the N95 respirators or the PPE or ventilators. We intend for that money to go to the medical community on the front lines in the states and the cities and localities who need it the most. Speaking of states and cities, $150 billion was in the CARES Act for local government, and about $15.3 billion of that is headed for California. We understand this coming week is when California will begin to see that money. And specifically within that budget in California, $559.4 million is estimated to be coming to San Diego County, $534.8 million coming to Orange County. And then, of course, for workers and their families, a significant expansion of unemployment insurance, an extra $600 a week, and expanded eligibility for those who are 1099 independent contractors or gig economy workers. The extra $600 is a big deal. The most you could get via unemployment insurance previously was around $1,800, and now this will bring it to up to $4,200 per month. And of course, that is for 4 months as well. So we hope that those of you who have had to apply for unemployment insurance have been able to avail yourselves of the new unemployment benefits, the expanded unemployment insurance benefits. We've heard from the California Secretary of Labor that I spoke with this past week that for 1099 workers and for gig economy workers, the California EDD at the state level is working very hard to take that directive from the Congress and to implement those expansions at the state level, and that those expansions will be made available very, very soon. Also now being distributed are cash payments of up to $1,200 for individuals. And my hope is that if you're a filer, electronic filer with the IRS, that you may have already received that cash payment. On the other hand, if you are not, the IRS has set up a website where you can set up direct deposit. If you choose to wait for a paper check, those checks are going to take longer. So I would encourage everyone to file with the IRS for direct deposit so you can get those funds as quickly as possible. Finally, the CARES Act included $350 billion for the Paycheck Protection Program, also known as the PPP. Those are forgivable loans of up to $10 million for small businesses and nonprofit organizations of 500 people and below. And the idea with them was very simple: to maintain the existing workforce and to help pay for other expenses like rent, mortgage, and utilities. I know how frustrated small business owners are out there because I hear from them every single day for two reasons. First, that the PPP program took too long to get up and running, and then that the funds were allocated very quickly. And I know that the funds ran out this past Wednesday. I stand ready to fly back to Washington at a moment's notice if I have to, despite the fact Dr. Garfield may not like that too much, me flying right now. But if that's what it takes, I'm ready, willing, and able to immediately fly out there to vote to increase funding for that program. There's broad bipartisan support for another $250 billion in funding for small business. And I'm encouraged to say there's also bipartisan support now for an additional $100 billion for funding for hospitals, which is so desperately needed. I also strongly believe that we need another $150 billion for our state and local government, and that we need expanded nutrition assistance as well. So I will continue to fight for those things and advocate for those things, but I stand ready, willing, and able to go to Washington right now to vote on the expanded small business funding. And I hope we get that done and put politics aside. So there are other things beyond the CARES Act that I wanted to comment on that we've been able to do this past week with regard to COVID. First is the Coronavirus Community Relief Act, which would set up a local stabilization fund for cities with fewer than 500,000 people. I'm a co-sponsor of that bill. I've spoken with nearly every mayor throughout our district, and I know that many of our cities are struggling financially. The tax revenues they're used to seeing, particularly those cities that are dependent on tourism and recreation, they are not seeing those revenues. So I'm very mindful of that, and we'll continue to fight for our funding for our cities, particularly our cities of less than 500,000, as we move forward. On Tuesday, I was pleased to announce that the higher education institutions in the 49th District got a combined $44 million as part of the CARES Act. That includes $35 million for UCSD, $5.5 million for MiraCosta, and $4.3 million for Saddleback College. Those funds follow a letter that I wrote the prior week to Education Secretary Betsy DeVos, demanding on expedited implementation of the CARES Act to get that money to our higher education institutions and our K through 12 institutions as quickly as possible. So I am encouraged to see that at least some of that money got to where it needed to go. On Thursday, the Los Angeles Times wrote a story called "Trump Plan for Coronavirus Supplies Yields Payoff for Favored Companies." And this story followed a letter that I wrote with 56 of my colleagues. I led the letter and 56 of my colleagues signed it the prior week about a secretive plan, unfortunately, that FEMA had in place basically to provide tens of millions of dollars in taxpayer subsidies to a handful of the nation's largest medical supply companies with really very little public accounting. So I'm very pleased to see that article was written. I encourage our viewers to check it out and our listeners to check it out. And we're going to stay on FEMA to ensure that funds are transparent and that the programs are accountable. On Friday, so just a couple days ago, I led another letter that was signed by 72 of my colleagues, bipartisan letter, urging Health and Human Services to support healthcare providers who have high Medicaid volumes, such as community health centers. The community health centers received some under the CARES Act, but not nearly enough, and they are really struggling right now from my conversations with them. I'm also continuing to lead an effort with my friend Rodney Davis, Republican of Illinois, to try to get the Prevent Family Fire Act as part of the next round of coronavirus relief. Our bill would provide a tax credit for the safe storage of firearms, and we know that such a tax credit and the adoption of safe storage devices could dramatically reduce the rate of firearm-related accidents in the home, particularly important given that right now everyone is at home, including many young children. So the other thing that I wanted to mention, very sad to hear the reports of increases in domestic violence as a result of COVID-19. I encourage anyone in need of help to call or text the National Domestic Violence Hotline at 1-800-799-SAFE. Again, that's 1-800-799-SAFE. I'll close with just a few local updates. You probably know that we continue to have strict social distancing in place. As they have said, stay in place, maintain your space, and cover your face. I'll let Dr. Garfien comment a little bit on what's going to be needed in order to relieve us of some of those guidelines in the weeks and months ahead. There is good news with regard to testing at the local level. UC San Diego continues to expand the availability of testing. There's new rapid testing from Abbott. They're working with Roche and other companies. I'm truly impressed and encouraged by all the great work happening throughout North County, San Diego. and South Orange County from our great companies who are trying to lead the way on diagnostics, on therapeutics, and eventually, very importantly, on the development of a vaccine. We need all of the above. I'm also very pleased that Memorial Care now has up and running their second drive-through testing center in South Orange County. And I'm encouraged by much of the progress that we're making locally, and very, very grateful that we've been able to lead as Californians, that we've been able to, in fact, send excess ventilators to other states in need like New York. That made me incredibly proud to be a Californian. I also know that we need to do a lot more at the federal level. And as a federal elected representative, I am mindful of the fact that we need and we lack a national testing strategy, because the only way we're going to truly get this virus behind us and get back on track economically is if we have widespread national testing, is if we get to widespread antibody testing, contact tracing, and eventually we're able to isolate this virus. But lots and lots of leadership is needed from the federal government, and I will continue to do all I can to encourage this administration to lead on testing. So with that, I will turn it over to Dr. Garfien for his opening statement, after which we get to the best part, which is your questions. Dr. Garfien.
All right. Thanks, Congressman. That was a lot to take in. And I'll just say, as far as you flying, I have a friend who's a pilot, and he assures me that those planes are cleaned every single day.
All right.
He feels safe flying, and they space out the passengers. And in fact, he said the passengers are all bringing their own disinfectants and wiping down the inside of the plane. So he actually feels like the planes are cleaner at the end of the day.
I will have my mask. By the way, my friend Louise Herbert, she's now made 2,500 of these masks. Truly amazing. So I'll have my mask. I'll have my wipes. I'm ready to go.
All right. So I think this is a pandemic that we can beat. We just have to be smart about it. We have to use the science, and we have to know what we're doing and how to do it. So I thought what I would just do is take a couple of minutes to talk about what it's going to take to get back to normal. And it's going to be a heavy lift, but I think we could do it. And the first thing is that, you know, we already understand the virus quite well. We know what a coronavirus is. It's already been well described. We already have the tools that we need to make vaccines and to do the testing. It's just really a matter of ramping up and then using the information that we have to do the best that we can to try to minimize the impact of the virus until we get through this. And so I think the virus is what we understand. What we don't understand real well is how human beings are going to behave when it comes to dealing with the virus. That's going to be the harder question. So, you know, personally, I think that the key is that we're trying to slow down the pace of the epidemic to keep the burden on the healthcare system manageable and avoid unnecessary deaths long enough to identify safe and effective treatments and vaccines. So going back to normal requires opening up the tap slowly, monitoring how things are going and how they're working along the way, and being ready to close the tap back down quickly if things start to get out of control again. So it's all about managing the virus. I think this is a virus that is new to the human population, so none of us have natural innate immunity, so we're all susceptible. And so essentially the virus either has to get to a point where we've identified every person who's infected, isolated them, waited till they recovered from the infection and didn't infect anybody else, and the disease eventually dies out. That's what we saw with SARS-1. You know, we only had 774 deaths in that whole epidemic, but it wasn't transmitted as easily as this virus is. But if we use those same tools that we've used for that to contain the virus and control it and prevent the spread, theoretically, it could, infect its last person and die out, and then we don't have to wait until everybody's been exposed. But in the meantime, people are going to become infected, and then the good news is that after they've been infected and they recover, they have some antibodies, which for at least some period of time we know will protect them from becoming infected again. And we won't know until, over time how long that immunity lasts, but we think it's going to be fairly durable. So the question is, how do we go back to life as we knew it with the tools that we have? So this is going to depend on a number of factors. First of all, do we have enough personal protective equipment for all the healthcare workers to make sure that those people on the front lines are safe? And then the hospitals have to have the capacity to be able to handle patients who come in with severe illness from COVID-19. So that means having enough ventilators, having enough staff who are healthy and able to do the job, and have the infrastructure to be able to handle those cases. As long as we can sort of keep our capacity above the level of the cases, then having cases of COVID is, it's a burden on society, but it's not, the end of the world. It only really becomes a huge problem when the amount of disease outpaces the amount of capacity. That's when doctors have to start making decisions about who's going to get a ventilator and who's not, and the system starts to break down. So we're really trying to stay below that line. The next thing that's really important is testing. So we've talked about antibody tests and viral tests, and just to remind people, the viral test, which is the swab in your nose or throat, tests for the virus itself to see if the person actually has the virus in their system and could potentially spread it to others and is actually sick. The antibody test is a test of the blood that looks for proteins that our bodies make to fight off the virus, called antibodies. And those proteins stick around after the person has already recovered from the infection, so we can tell who's been infected in the past. And as far as we know, having antibodies is an indication that that person will not get infected again and could be, go back to work and be exposed without becoming infected again or exposing somebody else. The other thing that's really important is that we need to have in place a good system for doing contact tracing and isolation. So as I mentioned, if we could get our arms around this virus and sequester the people that are sick so that they can't infect anybody else, we could break those chains and we can actually stamp out this virus before we have to wait till everybody's been infected. So that requires a cadre of people that spend a lot of time being notified of who the cases are and then contacting them, finding out who they've been in contact with, and then contacting their contacts and notifying them that they might have been exposed so that they can shelter in place and prevent exposing anybody else while they might be developing the disease. Because we know that you could be infectious for a day or two before you actually have symptoms. So we really have to make sure that people who might have been exposed know that they have, so that they can avoid infecting somebody else before they realize they're sick. And then we have to, the other thing that's really going to be important is what's the status of treatment and vaccines. So if we had a really good treatment where as soon as somebody got exposed, we can give them a treatment and it would prevent them from getting sick, or if they were sick, you could minimize the symptoms so that they don't end up in the hospital, that would be fantastic. Then we just deal with this like the common cold. It's not a big deal. Also, if we have a vaccine that would protect people, we can vaccinate the population that's susceptible, and we don't have to worry about them becoming infected. And obviously, we'd start with the most vulnerable people first and then work our way through to the rest of the population. That would be another great way to end this epidemic. And then finally, we have to consider what's our ability to maintain social distancing. So under these stay-at-home orders from the national level, everybody's staying at home. But as that starts to go away and different states start to remove their stay-at-home orders and people start to go back to work, are we going to be able to maintain social distancing? When you're at school, can you stay 6 feet away from people around you? When you go to the market, can you? When you go back to your office, what kind of a job do you have? Are you going to be able to maintain a social distance? And if not, are you going to have the personal protective equipment necessary to protect you and those around you? So we really have to think about this. It's not just like we go back to normal. We're going to go back to work, but we're going to be going back to work under some really different conditions. And so that's important to consider. So just to sort of wrap this up in terms of thinking about the order of going back to business as usual, I think that sort of the first thing is we want to get our businesses back open again. We want people to go back to work. So we need to make sure that they have the ability to do that and do it safely. So, social distancing, personal protective equipment, maybe even like dividing shifts, so you have half the people working at night and half the people working in the day, so that you can keep people more separate. Also providing them health care so that they have the ability to get tested, and if they do get sick, they can they can stay at home and not expose anybody else. Then I think we have to start thinking about getting people back into the schools. And this is really challenging because, I've heard people say, well, kids don't get sick from coronavirus, and very few of them die from it, and so why not let them go back to school? It's not a problem. Well, as the husband of an elementary school teacher, I can tell you that kids are sponges, and they might not feel like they're sick, but they're going to come home and they're going to give everything that they got to you. And for the first 5 years I was with my wife, I got every one of those childhood diseases all over again. She was never sick, but I got strep throat, I had colds, I got the flu. So think about that. These kids are going to come home and they're going to be coming into the household where maybe there's elderly grandparents that are cohabitating with the family. The caregivers of these kids might be, have diabetes or heart disease or other conditions that could put them at risk. So it's not just about the kids being safe, it's who those kids are actually going to be coming in contact with that we really have to think about. And then teachers, a lot of teachers are in high-risk groups. So, who's going to teach the kids if those teachers can't go back to work? So we really have to think about that carefully. I know it's a really high priority, but we have to think about how to do that safely. Then I think we can start talking about, opening parks and beaches again and getting back to sort of some semblance of normality. But I think, again, we have to do that in a way that everybody understands. We need to maintain some social distance until, we get ahead of this disease. And the good thing is that I think that now that we've all had a taste of it, we know what social distancing means. When we say you can go to the beach, but you have to be 6 feet away, everybody understands what that means now. And then that could be enforced if necessary. And then finally, I think it comes to, the question is, when are we going to be able to go back to football games, and when are we going to go to concerts and things like that? I think that, to be honest, that's really at the end of the list. That's going to be one of the last things that we're going to be able to really do is these large public gatherings. And the way that would happen is either we have a vaccine or enough people have already gotten sick that we have, herd immunity. We have enough people in the population that really not that many people are left to get sick. And then the people that are susceptible, maybe those people can wear a mask when they go to the concert and they'll protect themselves. Otherwise, there's going to have to be ways that we can attend these events in a safe way with some sort of distancing, maybe separation of people that are susceptible versus immune. It's going to be challenging, but I think that that's kind of the thing that we need to be. That's our goal at the end. That's when we're going to know we're really over this, but I don't think that's going to happen anytime soon.
Thank you, Dr. Garfien. As always, that was an outstanding overview, and we're always grateful, and it's amazing to see the progression week to week on kind of where we are and where things stand. So we're very thankful for that. And we've got a bunch of questions. We're going to get to as many as we can. Sheila in Carlsbad has the first one. She asks, what is being offered for those who work on gig jobs or independents who are 1099 workers? Where do they go for help? Well, Sheila, the intent of the CARES Act was to expand unemployment insurance eligibility for people that are in exactly that situation. So the idea was an extra $600 a week and expanded eligibility. Now, the California Employment Development Department, along with the other states, they are left to implement what Congress has asked or what Congress has funded. In this case, the expanded funding and the expanded eligibility. The situation in California is that the expanded payments are now, I believe, available to people from everything that we've been hearing anecdotally and that we've heard from the California Secretary of Labor. And the expanded eligibility for 1099 and gig workers is supposed to be available on April 28th. And they call it the Pandemic Unemployment Assistance, or PUA program. They are going to be creating a web portal where you can sign up, one-stop shop for those applying. And what we've been told is that PUA benefits will be issued within 24 to 48 hours once approved, not the traditional 21 days for regular unemployment insurance claims. So, Sheila, I hope we get that help to you very quickly. And if for whatever reason you're having trouble, please contact our office and we'd be happy to assist. Here's a question for Dr. Garfien from Curtis in Carlsbad. Do we know what the minimum number of virus units are in order to infect someone, and how does that compare to other better known viruses?
That's a great question. It's a hard one to answer. So the quantity of the virus necessary to cause infection, sometimes we call it the infectious dose, it hasn't been determined yet. nor has it been established whether a larger dose is associated with more severe illness. Also, the infectious dose shouldn't be confused with the quantity of virus or the viral load that's found in someone's nose and throat. The kinds of studies that would be needed to definitively answer that kind of question, they're difficult and potentially unethical, since it would require exposing people to the virus and then observing what happens. But we can get a good idea from observing what's happened so far. So, for example, health workers investigating the COVID-19 outbreak in the Lombardy region of Italy looked at more than 5,000 infected people and found no difference in the viral load between those with symptoms and those without symptoms. And then similarly, doctors in a hospital in China took repeated throat samples from 94 COVID-19 patients, starting on the day that they became ill and finishing when they cleared the virus. And they found that there were no obvious differences in viral load between the milder patients' cases and those with more severe symptoms. So what's unique about viruses is that a single virus can get into a cell, and it can what it does is it basically takes the machinery from that cell and it converts it from doing whatever it normally does, and then turns it into a virus-making machine. And so that single cell can pump out a lot of virus. And so it doesn't take more, and then those viruses go and infect other cells. And very rapidly, the number of viruses that are circulating in the patient become huge. And that's why we see so much virus in the nose and throat. So whether it's one virus that starts that process or 100 viruses that start that process, pretty soon the amount of virus that's in the person is sort of not dependent on what that initial dose was. So it kind of makes sense that you wouldn't necessarily expect to see that the dose is associated with the severity of disease. However, that's my experience as an infectious disease epidemiologist. People have tried to look at this with other viral infections. It doesn't look like there's a real strong correlation there, but until those studies are actually done, we can't say definitively that there's no relationship at all.
Thank you, Doctor. Tim and Misty, also in Carlsbad, and actually there's a similar question from Maureen in San Juan Capistrano. The questions are, first, what is in the bills in the upcoming fourth bill that allows renters reduced or no rent while landlords are able to be remedied? And then another question, what happens when the rent has been deferred, comes due, and we don't have money to pay because we lost our jobs? Is there any information on that or any resources? Well, I've heard about this a lot since we rolled out the CARES Act and even before that with the Families First Act. I would like to see, as part of our fourth bill, $100 billion in emergency rental assistance. I've advocated for that. I think that, the bill that is being discussed right now that would expand the small business program, the hospital program, and perhaps a couple of other things, I would consider that to be like Bill 3.5. And we're going to have a more robust fourth bill coming. And that's where I and others will be making the push for things like expanded rental assistance. But my great hope is that a lot of the other things in the third bill, like the expanded unemployment assistance, as we just discussed, the direct cash payments, and the other economic recovery measures, hopefully will be of some assistance in the near term. But I am very encouraged also by what the state of California has done, and by what a lot of local cities and even some landlords are doing to try to make life a little bit easier for residential and commercial tenants. I do think we're going to have to also do a lot more downstream with regard to mortgages. I'm very aware of the challenges that the mortgage industry will be facing in the months and years ahead. Christine in San Juan Capistrano asks, will you need to return to D.C. to vote, or is the representative from Kentucky standing down? Well, the representative from Kentucky, Tom Massey, for those that remember, he compelled us all to go back to Washington now 3-4 weeks ago to vote for the CARES Act, despite the fact that you had 434 members of Congress that thought it was worth voting for. And we obviously saw it as being absolutely essential that while the bill wasn't perfect by any stretch of the imagination, we definitely had to act aggressively in the face of these crises, the public health and economic crises. What I have read is that he is not standing down, that he is going to continue to compel in-person roll call voting. and that means we're going to need a quorum in attendance again. And so I'm standing by, ready, willing, and able, as I said before, to take the next flight that I need to take to get out there to vote. I wish that Congress had a remote voting scheme in place, but we don't for the time being. There has been discussion this past week about a proxy remote voting plan whereby we could have members perhaps that live in the DC area or nearby, or who could get there more easily or at lower risk, could vote by proxy. We could make those folks our proxies, and they could vote for us. That's been discussed, but that too would take a vote, unanimous vote to change the rules. And so we may see ourselves going to Washington to vote on this Bill 3.5 for expanded small business and hospital funding, and then hopefully also a rule change at the same time to enable proxy voting. So that's what you have, Doctor, with a very old institution. Probably need to go back on another plane sometime soon. Here's a question for both of us. This is from Al in Oceanside, and it says, Dr. Emanuel, I don't know who that is, but it says, Dr. Emanuel said he believes large gatherings will not be able to start again until fall 2021. Holy moly. From what both of you have learned, do both of you agree with him? I'm going to trust the doctor's advice first.
Well, I'll give him my best shot. So I believe that's referring to Dr. Jonathan Zeke Emanuel, who's a bioethicist at the NIH, and actually the brother of Rahm Emanuel from Illinois. Yeah, really smart family, apparently. But, you know, I think this is, I sort of touched on this already, which is that I think that it's going to be a long time before we can really go back to those large gatherings. For the reasons that I gave. I think that Dr. Emanuel is correct in that. I think we all want to see it happen. The sooner the better. I mean, our economy depends on it, and I think, you know, personally, our you know, satisfaction with life and things that we like to do are going to be dependent on being able to gather and gather together. So I think it's going to, you know, we have to get over these first hurdles first. We need a good treatment. And those clinical trials are ongoing right now to find out what treatments work and what don't. We're working on vaccines so that we can get people vaccinated. Those trials also are underway, and they're starting to look positive, but they've got a long ways to go before we have the definitive answer. And then those vaccines have to be manufactured, which takes even more time. But I think that it's also going to be, and then testing, you know, once people actually know what their status is and we have a better understanding of who's been infected already and who's not, who's susceptible and who's immune, I think then we can start to make some educated decisions about what's appropriate in terms of going back. And even if there's a risk of being infected by going to one of these large gatherings, if we've gotten to the point where the healthcare system can handle the additional cases that might occur after one of these events, then I think we're going to be able to go back to these events sooner. So I agree with Dr. Emanuel that it's not going to be the first thing we're going to be doing. It's going to take a while, but I think it's, you know, it's part of the long-term plan. Wow.
Okay. So do you think, you know, I don't know, Super Bowl next year? It's in early February, if I recall.
Sure.
You think we'll be ready? Maybe not?
I think a lot of us are going to still watch it on TV, but hey, I'm
And I think in Tokyo they delayed the Olympics till the summer of 2021, right? So that'll be another interesting data point. Michael in Carlsbad asks, "Hi, Mike. I'm a physician who lives in Carlsbad and works in OC. Michael, I know your commute very well. He says, I've been closely tracking the development of the pandemic. My major concern is really to increase the number of testing. I have tracked testing data in both San Diego and Orange County. In my opinion, we need to expand testing to individuals who are younger, have milder symptoms, or people who work on any field that involves contact with people other than their household members. We cannot even tell if our measured actions we have now taken are effective or how effective they are." Michael, you raise a lot of good points in there. I completely concur. that we need widespread testing. If you look at some of the research out there, Scott Gottlieb, who was President Trump's former FDA commissioner, has said we need around 500,000 tests a day or more. I think we're now doing around a fifth of that from what I've seen, and that's better certainly than where we were. But we got out of the gates very slowly by virtue of problems that have been well documented at CDC with one of the reagents that were used. And there was an article just this morning about why that may have occurred. And then the FDA also, around the same time frame, particularly in January, did not allow enough of the commercial and clinical labs to have emergency use authorization quickly enough. We're now playing catch up in that regard. But I do think that we need a coordinated federal approach on this, particularly with regard to things like supply chain management. And I'll certainly continue to advocate for that. Locally, I see the data every day in San Diego and Orange counties, and San Diego is well ahead of Orange County in terms of testing. I was just speaking with my friend Pat Bates, who's a state senator, represents, like me, both Orange and San Diego counties. And we're both concerned by this because right now, San Diego's tested over 30,000 people. Orange County's tested roughly half that. So when folks look at the data and they see that San Diego County has more cases, 2,100 as opposed to around 1,600 in Orange County, I always try to temper their conclusion that San Diego is somehow doing worse because they have more cases. They've tested twice the people. That's why you've seen more cases, positive cases. So Orange County has a lot of catch up to do, and I think we're going to continue to push them, push the county to try to ramp up their testing as much as we can. But your points are all very well taken. Anything to add to any of that on testing?
Well, Congressman, you're starting to talk like an epidemiologist. I'm really impressed.
I don't know.
I would just agree that we definitely need to test more people. However, until there's enough tests to go around, there's going to remain a need to prioritize. So first and foremost, our frontline workers, the healthcare providers, EMTs, firefighters, people, caregivers for people in residency homes. Those people need to know what their status is because they're most likely to be exposed or highly likely to expose somebody else. And so they're going to need to be tested first, and that's actually happening quite well right now. There's enough testing to go around for our healthcare providers. The drive-up testing clinics are really designed to serve that population as well. The next group that would be targeted would be the next group that I think we'd want to test are the general population to get a sense of the epidemiology of the disease, like what proportion of the population is actually already immune, how many people actually had infection but never had symptoms. It would be very interesting to get a handle on that, and rather than opening up testing to everybody, I think that would be done as special studies. So there would be studies done in different locations with samples of the population to find out what their status is. And then once we get enough tests available, then I think moving to the general population so that anybody who's concerned about risk of exposure to themselves or to their contacts could get a test as well.
Thank you for that, and hopefully that happens sooner rather than later. Obviously, couple mask questions for you. Here's one from Jean. She says, if you wear a cloth mask only once a week, or once in a week, or 10 days, can you simply put it aside where it won't be touched after a wearing? I've heard that the virus is only viable for a matter of days. Well,
so, Gene, the good news is that cloth mask can go in your laundry with everything else. So rather than putting it aside and hoping that all the virus and any other pathogens that might be on the mask die, my advice is put it in the wash. And the good news is that you can put it in the regular wash with everybody else's clothes. You don't have to treat it differently. Ideally, you want to use the same amount of soap as you would normally use, and use the hottest water that you can. That's safe for your clothing. and then put it in the dryer. And if the dryer's hot, that's going to kill any viruses that might be on it as well. So that's what would be my recommendation. There are some guidance for non-washable masks that the CDC has put out, and this is really only something you would do in an absolute emergency where there is no other option. And that is that healthcare workers that might not have enough masks have been told if you're given 5 masks and you have 5 paper bags, you wear 1 mask and you put it into a paper bag at the end of the day and you label it with the date and you close it up and you leave it there for 5 days, and you do that with each of your masks, and then at the end of 5 days you go back to the first mask. And by then, we know from studies that the virus doesn't live that long on surfaces like masks, that the virus should be dead. Now, if you're working in a healthcare setting, there could be other, nasties on that mask as well that might survive longer, like, drug-resistant Staph aureus and things like that. So it's not ideal, but in this situation, if you had to do something, that's something that's being recommended. So, and I just bring that up to avoid confusion that some people might have if they've heard that recommendation. It is something that can be done if you actually have to, but it's certainly a last resort.
Follow-up question from Louise in San Clemente. Can face masks be sterilized in the microwave if they do not contain metal?
So the CDC, and I've read a study out of Stanford, does not recommend microwaving. In fact, the CDC says that you shouldn't attempt to disinfect a mask at home at all. And I'll talk a little bit about some of the other methods that can be used. If it's a cloth mask, you can just wash it, like I said. So that would work better actually than putting it in the microwave. But if it was a N95 mask or a surgical mask, the problem with putting those in the microwave is that it'll break down the plastic. And the study from Stanford actually looked at that, and they showed that it does actually deteriorate the fabric in the mask, and they don't recommend it. Also, if you're using surgical masks or N95s, the ways that they can be disinfected include ethylene oxide exposure, ultraviolet germicidal irradiation, basically putting them under UV light, and vaporous hydrogen peroxide decontamination. These have been found to be safe, and they don't break down the material in the mask much, and so you may hear about these methods. But these are not something that you can do at home. These are something that are done in facilities that have the ability to do that correctly. Heat and steam can also help, but again, the conditions that you would be able to generate in your home kitchen might not be ideal for doing that and could potentially damage the mask. And then finally, in terms of trying to decontaminate a surgical mask or an N95 mask, is that the more times you do it or the more you manipulate it, it could affect the way that the mask fits, and if the mask doesn't fit you correctly, then it actually increases your risk of becoming infected or infecting somebody else. So cloth masks, put them in the wash. Other masks, try not to, I don't have any good advice for anybody to decontaminate those at home. Oh, and by the way, don't use chlorine, bleach products, or alcohol because they can be dangerous if you put the mask on and breathe in those chemicals.
Wow. Thank you for that. Tony in Capistrano Beach asks, Mike, all of these programs are great, but at what point do we also recognize that the national debt is growing exponentially? I recognize the need for stimulus and very necessary help for individuals and businesses, but we can't just print money. Our debt ratios are looking more and more like Greece. What can we do to make sure the national debt doesn't get even more out of hand than it already is? Tony, I absolutely agree with you. This is a huge challenge and something that those of you who have heard me before or gone to any of my events or town halls over the last 3 years know that I am deeply concerned with our national debt and the deficits we've been running, and that was before COVID-19. In particular, I am concerned that this year our deficit to GDP ratio will be on the order of 13%. The estimates that I've seen around our national debt long term, it could go 28, 29, 30 trillion dollars. And as a percentage of our overall spending, the payment on that debt is getting greater and greater. So I think we're going to have to dig very deep in the coming years, and we're going to need another Simpson-Bowles style commission. For those that remember, many years ago, we took a hard look at revenue and at spending. Unfortunately, we weren't able to enact many of the recommendations from Simpson-Bowles, but I think we're going to have to look anew, while also mindful of the vulnerabilities that we have seen as a result of COVID. We're going to need to spend on things like access to broadband. If we're expecting people to work and study from home, they've got to have access to the internet. We've got over 20 million Americans that still don't have access to broadband. We've got to do all we can, I believe, to ensure that people can survive an emergency. And we have 53% of our country, we've learned, that don't have a basic emergency fund in place. That was before COVID. That's why it's so critically important that we had those direct cash payments and that expanded unemployment insurance. And we've had over 30 million. We now know over 30 million people lack paid sick leave. Over 30 million lack health insurance. And so we've got to do all we can to balance the priority of getting our fiscal house in order with making sure that the next time that there is a pandemic, that we're better prepared and that we don't have the gaping holes in the safety net that we've seen that has exacerbated what would already have been a very difficult situation. But I'm going to do everything I can, Tony, to try to work on this across the aisle whenever possible. And I appreciate the question very much. Question for you, Dr. Garfien, from Phil, who is a physician in Carlsbad. Carlsbad is very well represented today, I've got to say. He asks, I would like to know what Dr. Garfien thinks of having a pulse oximeter at home to follow our percent of blood oxygenated if we get sick with COVID-19. They might be useful as an earlier warning sign for people at home who are having ongoing trouble breathing who should get to the hospital. Thoughts?
Yeah, Phil, that's a great question. And since I'm not a clinician, I had my thoughts on this, so I double-checked them with a friend of mine who's a pulmonologist here at UCSD just to confirm my thinking. So for people who don't know what a pulse oximeter is, it's a little device that clips onto your fingertip. Sort of looks like a hair clip, and it can tell the amount of oxygen that is in your blood. You know, we want it to be close to 100%, but it can drop down low, and that reduction in oxygen in the blood is an indication that the lungs aren't working well. There's a lot of them on the market right now because they've become very popular with athletes that want to see if they're, how their exercise is affecting their blood oxygen and how that's affecting their performance. So they're out there, and if you look on the internet, there's, tons, and they range in price from, a few dollars to $100 or more. But the answer from my colleague is, yeah, it's actually a really good idea. If you have a person who's at home with COVID and they're having symptoms, there isn't a good cut point in which to say once your oxygen gets down to a certain level, 85, 80, 75%, that's the time to go to the doctor. But sort of like taking your temperature, it's easy to do. A patient can do that at home on their own. And then when they do call the doctor, if they are able to tell the doctor what their oxygen saturation level is at the same time that they're also describing their other symptoms, it'll give the doctor a little bit more information that they can use to decide, hey, it's time to come in now, or, maybe you look like you're doing okay, and maybe you can, stay at home and avoid being in contact with other people. So it's a great suggestion. Doctors here at UCSD would say that's a good idea to use them if you have them. And the one caveat I would say is be careful when you're buying these things online. They're not FDA regulated medical devices, so you want to get one that's of decent quality to make sure that you get good measures. And so read the reviews when you buy them.
Thank you for that. I will not be buying one anytime soon, but what can I say?
You never need one.
That's right. Maura in Capistrano Beach asks, not one unsheltered person in South Orange County has been brought indoors. Tell me how we, concerned citizens, can help our homeless neighbors indoors. Who has the credit card to pay for rooms? Wow, if it were only that easy, Maura. We have to do so much more to provide shelter for those who are homeless, and really have to be mindful also of those who are on the brink of homelessness. I can tell you that the County of Orange has done a fair amount in terms of trying to secure hotel and motel rooms. I think around 500 is what I've read. But we've got to do a lot more. And I've been also very encouraged by what I've seen from San Diego, where they opened up the convention center in Golden Hall and downtown. And you know, the mayor, Kevin Faulconer, has now said that the city would just go and buy hotels potentially to house people. So I'm always mindful of that. And this is another of those national safety net challenges that we've got. We've got over 500,000 people homeless in the United States. And of course, we want to do everything we can to ensure that the acuity of COVID within the homeless population is addressed. You know, always mindful as well of the veteran homeless population. We have been making such great progress on that with a lot of different initiatives through the Veterans Affairs Department, and I've been very familiar with those programs, whether it be HUD-VASH or SSDF or all those programs. And I do worry about a spike in veteran homelessness and in veteran unemployment. And I'm already talking to my colleagues in the Veterans Affairs Committee and the VA, try to figure out how we can address that as quickly as we can. Dr. Garfien, Curtis in Carlsbad asks, can animals contract and or carry the virus? And I have to say, I did read a story, I think, about a lion that had contracted the virus. But prior to that, I've heard that animals could not. Any thoughts?
Yeah, I think that was a lion in the New York City Zoo or someplace like that. I read that as well. You know, if you asked me this question about 3 weeks ago, I would have said that dogs and cats can't get infected. But since then, there's been a couple of articles that have come out. To date, the only pets that were incidentally exposed to COVID-19 that have tested positive for the virus, there were 2 pet dogs in Hong Kong and 2 pet cats, one in Belgium and one in Hong Kong, that have been reported. In each of those cases, the pet was in the care of and had close contact with a confirmed case of COVID-19. So these findings indicate that dogs and cats are not infected easily with the virus. If they were, we'd see a whole lot more of these infections. So there's not evidence that they play there's no evidence that they play a role in transmission of the virus. So just because a dog or cat is infected, they may or may not be able to infect others, and it doesn't seem like they're a big source of transmission. But the American Veterinary Medical Association does recommend that if you are ill with COVID-19, that there's some recommendations for how you should be around your pets. And so they would say, just as if it was a family member, you'd want to protect your pet just out of the remote possibility that they could get infected. So they recommend restricting contact with pets and other animals, just as you would a human being in your household if you're sick. Also, when possible, have another member of your household take care of feeding or otherwise caring for any animals. And if you have a service animal or you must care for your animal, wear a cloth face covering, don't pet, share food, or kiss or hug that animal, and wash your hands before and after any contact with the animal. And then finally, you know, don't share any dishes, cups, or food with the animal. I know some people are very close to their pets, and they do share treats and things like that. But that would be discouraged at a time like this.
I do not share treats with any pets, but what can I say? Ashley in San Clemente asks, are there protections for high-risk people, independent contractors, who lose their jobs due to their employer not allowing them to wear any form of protective covering, such as masks and gloves? Well, Ashley, I would say that is completely inappropriate for an employer to require that you not wear masks or gloves, and you have rights under federal and state law, and I would encourage you to contact my office and we can help point you in the right direction, because no employer should be penalizing you or their employees for not following the guidance of the state and the federal government. So you absolutely have workplace rights to be able to wear a mask if that's what you need to keep yourself safe. Here's a question for you, Dr. Garfien. This is from Kelly in Encinitas. Kelly asks, if you feel you may be experiencing the onset of symptoms, what countermeasures can you take now to lessen the impact on your health?
That's a great question. This is sort of like the flu. Well, I shouldn't say it's like the flu, because the flu, actually, we have Tamiflu that you can take when you start to feel symptoms, and that reduces the disease. We don't have that yet for coronavirus. Hopefully we will. But what you can do is take care of yourself, mainly rest, stay hydrated. The disease causes fever. Fever can lead to hydration very easily, so make sure you're drinking a lot of fluids. And then eat a proper diet, do everything you can to basically stay healthy, and for the most part, rest. Give your body a chance to fight the infection and develop antibodies. Some non-steroidal anti-inflammatories like Tylenol and ibuprofen can help to reduce the fever and make you feel better, but just be aware that this doesn't reduce the viral load or decrease the amount of infectiousness. So if you take something and the fever goes down and you feel better, that doesn't mean go out and go back to work or go back to whatever you were doing. Give yourself a chance to heal. And then the recommendations by the CDC, I believe, is that you should be at least 72 hours since your last fever without using any of those medications before you can say that you have fully recovered and can go back to work.
Interesting. Kat in Oceanside asks, why hasn't San Diego County slipped or waived property taxes? Kat, that is a great question. I was pretty frustrated about this, to tell you the truth. I had hoped that our counties would give us a little bit more, flexibility with regard to property taxes. That a lot of them were due on April 10th for a lot of folks. And what they did do is they allowed for cancellation of the penalties. And in order to do that, you go to their websites, both San Diego and Orange counties, their treasurer tax collector website, and you can fill out a form that basically says that you've been directly impacted by COVID-19 and therefore need to pay later. What I learned is that, and perhaps this is a bigger issue to address downstream, that our county finances and the collection of those property taxes, they are pretty tight when it comes to the amount of cash they have on hand. And if they don't collect those taxes in April and then again in December, then there are all sorts of programs and services that will run out of money. And so I have new appreciation, and I think, frankly, we need to address that. But that's more of a county issue and a state issue than a federal issue, but nonetheless was frustrating because we were hopeful that we could get more relief for our property taxpayers. But I encourage you to go to those websites and see what you can do with regard to a waiver of penalties or any other direct payment issues that you've got as a result of COVID. Here's another question for both of us. This is from Dot. She asks, how can we convince those who refuse to stay at home and practice distancing, those who will not be told what to do, those who don't believe the CDC, that's your former employer, doctor, so don't take it too personally, those who don't believe the CDC, or frontline workers? Wow, good question. What do you think? What do we do?
Well, you're the policy guy. I was going to rely on you to answer that one.
Look, I think the best that I know to do is to continue to provide information based on science and facts to people, and hopefully you are hopeful that at the end of the day they will make decisions based on their physical well-being and the physical well-being of their family, their friends. And if they're young and healthy and feel invincible, Well, certainly they understand that if there are those who are at risk in their lives that are loved ones, that they could get sick, even if they could beat COVID. And that's when I hear people, well, it's no big deal, or 98% of people don't get very sick. But if we have that virus and it's not contained and it's allowed to be widespread, we are going to unnecessarily cause very large numbers of preventable death. And that's something to me that's just untenable. And, as far as it was asked earlier today, what about the politics of it? Well, the politics, I think, have to take an aside to keeping people healthy and keeping people alive. That's got to drive me more than anything else, and it does. And at the end of the day, I think that hopefully drives us all. What do you think, Doctor?
Yeah, I completely agree, Congressman. I think that it's a tough one. The good thing is, I guess, is that health officials do have the power to enact legal orders, and they can control the spread of a disease if necessary. And so if people are knowingly putting other people's life in jeopardy, then there are, legal ways to manage that. But I think that that's sort of a last resort. I agree with the Congressman that education is really critical. We want to use the best possible science. We want to do what we know is right to protect ourselves and protect our community. And so one thing I would recommend for people to do is, get information, get yourself educated, and try to rely on reliable sources like the health department, like the CDC, like the NIH. There's a lot of stuff that's coming out in the popular press. The popular press is intended to be inflammatory. They're trying to get you to read it. That they'll take a piece of information and which is a remote possibility, and then sort of blow it up into the what if, and then that's the message that you take away from it. And I don't think that's helpful. I think it's much better to try to stick with what we do know and use good science to base your decisions, and then try to help other people in your community to understand as well. If they're getting the wrong message and they feel like it's not important, try to provide them with that information that you got, that with good evidence to say, here's why we need to do this. And I think it's a good way to change people's minds and help to get them on board. So, and I think finally, with proper leadership, we can turn this into a fight between, us and the virus, as opposed to a fight amongst those that feel like it's time to go back to the beach and those who feel like it's not quite ready. We're not ready to go back to the beach.
Well said. And I think that's the important frame to make sure that we all understand the fight is really between us and the virus. And, I try to do that. And I think we all need to encourage our friends and family members and maybe those who are a little bit more impatient. And look, a lot of people are hurting out there. They need to get back to work. They rely on that job, and I get it, 110%. But again, it comes back to that basic framework, which is we cannot have a healthy economy unless we have healthy people, and we've got to get to the public health crisis first to really be able to effectively address the economic crisis for the long term. All right. Here's another one from Linda in Oceanside. She says, my work was unessential, but they wanted me to risk going to work with pre-existing conditions. Will I qualify for unemployment? Yes, Linda. If you've been let go or furloughed or laid off, you're absolutely eligible for unemployment. And I would encourage you to go to the California EDD website or contact our office if you have any questions about that. Here's a question for Dr. Garfield from Craig in Del Mar. Craig asks, I'm curious to know your opinion of convalescent plasma as a potential rescue therapy for patients who have become severely ill. Is it sufficiently scalable?
So there's two parts to that question. One is, what do I think about it? Which is, I think that it has good potential. And so there are studies going on right now to figure out if it is an effective treatment. And UCSD is actually enrolling participants right now as one of the sites that's doing a study like this. Convalescent plasma is basically taking the antibodies that have already been built up by somebody who's recovered from the disease from their blood, and then putting those antibodies into somebody who is now infected to help them to sort of get a jump start on fighting off the virus. And so it's worked with other diseases. I came from doing my early research on viral hepatitis, and we used to get calls all the time from people who have been exposed to hepatitis A at a restaurant where they had an outbreak, for example. And one of the recommendations was to, since it's too late to vaccinate, you can give the person what we call gamma globulin, which was an immune globulin made from people who had already been infected with hepatitis A, and it works very, very well. The thing that we have to be careful of is we can't just automatically assume that this will work with coronavirus. One, we don't know how effective it'll be, and two, we have to make sure that it's safe and it's not causing some adverse events. So that's the importance of doing these trials. We can't do it until they're done. And then in terms of your second question was about scalability, how can we do this at scale? And the issue is that a person who is recovered has only got a certain amount of blood, and so we can't take all their blood and give that to somebody else. So it requires an accumulation of enough people who have already recovered and have antibodies who are willing to give blood to create a bank of these samples that can then be used as therapy for other people. So scalability, it's going to be a challenge, but it would definitely be one more tool that we'll have in our arsenal for treating the disease if it works.
Thank you, Doctor, for that. Melody in Del Mar asks, why hasn't the President and or Congress activated the Medical Reserve Corps to help local and state health departments, especially with supporting the contact tracing efforts? Well, Melody, I think we're going to need a lot of people for contact tracing. I don't know whether or not it would be the Medical Reserve Corps or another entity, but I do think that we're going to need a lot of folks to volunteer. And I've been very encouraged by Governor Newsom setting up the California Health Corps. I don't think there's been enough specifics around that to know exactly what folks will do, but I'm sure that contact tracing will have to be part of that. I'd be very open to working with my colleagues on that sort of effort in the weeks ahead. So good suggestion. Dr. Garfien, another one from Mary, who is a former Carlsbad resident, doesn't say where she lives currently, former Carlsbad resident. Are corpses tested to help identify if COVID was the cause of death or contributed as a tipping point with comorbidities?
So, Mary, I guess it's true what they say. You can take the Carlsbad, you can take the woman out of Carlsbad, but you can't take the Carlsbad out of the woman. So I hear you. California is a great place to be, even if it's where you're from. So, good question. As far as I know, testing is not routinely performed by the medical examiners or the coroner's offices. The lack of tests is certainly one reason. You just can't afford to test everybody or every deceased individual. However, there are some county medical examiners like Snohomish County in Washington where they actually have guidelines for, first of all, if the patient was known or suspected to have coronavirus, they will be handled in a special way to make sure that the medical examiner and the people at the coroner's office don't become exposed. And then the question of whether or not they get tested to find out if they actually had coronavirus when they died, to include that in the cause of death, that's done on a case-by-case basis. And so I think that there's maybe a patchwork across the country in how this is being done. But I think the bigger question here is really, are there a substantial number of people who die of presumably other causes like a heart attack or cancer or some other reasons where maybe they also had coronavirus, and if we're not including coronavirus in the cause of death, are we undercounting the number of cases? And that's a real possibility, and so I think that it's worth looking into that. On a death certificate, there's the main cause of death, but then there's a place on the death certificate for about 3 other co-occurring conditions that might have contributed to death. And I think it's important to have that information on death certificates, not just for now, but in the future when we're trying to do research to understand really what happened in this epidemic. That information would be useful. But again, I think until we have enough capacity to do the testing on even every corpse, that might be a challenge.
Thank you for that. Janice in Oceanside and Danny in San Diego asked, hello, Mike. Thanks for holding these live town halls. Will we be able to vote by mail? I'm worried about this because of the media reports about the U.S. Postal Service being on the verge of collapse. Well, I am a strong proponent. I'm very concerned about this. I want to see national vote by mail. I wanted to see national vote by mail before the coronavirus. I want to see it now. And what happened recently in Wisconsin, where you had people literally choosing between being sick or getting sick and voting, casting their vote, I felt that was incomprehensible that in our democracy we would allow something like that to occur. We did include in the CARES Act a good amount, $400 million, for states to be able to implement safe elections. And unfortunately, there are far too many states in the union where secretaries of state discourage vote by mail, and I don't think they should be. I think there's absolutely no evidence of fraud or anything else when you actually look at the data and you see incidents of fraud, which are very, very low for voting, period. Generally, there is no good evidence that there's anything wrong with voting by mail. I think it's very simple. Everyone who is eligible to vote, we need to make sure that they can vote. And that's all this is about. And I'm proud of our efforts in California with our Secretary of State, Alex Padilla, who is committed to ensuring that if you are eligible to vote, that you can cast your vote as easily as possible. And so I hope that that will carry over. I am going to continue to push for that because I think it's very important. So is the U.S. Postal Service. And we put $10 billion in the CARES Act for the USPS. It wasn't nearly enough. The USPS was on shaky financial footing before COVID, and it's on much shakier financial footing now. There are some that just want to privatize the operations of the Postal Service and just, I guess, hand it over to FedEx and UPS. And I'm not picking on FedEx or UPS, but I think it is critically important that we maintain the United States Postal Service. And I look at it through the lens of my subcommittee that I chair, being responsible for the employment of veterans. There are over 100,000 veterans working at the U.S. Postal Service. I am grateful to them. I'm grateful to everyone who's working at the Postal Service to try to keep our mail delivered on time. So critically important that we do all we can to save the long-term financial viability of the Postal Service. I'm absolutely committed to doing that. We've got to do it, and I'm very hopeful it'll be bipartisan as well. So I hope I was clear. Here's a question from Gus in Oceanside, and I guess several others have asked similar questions. Thank you for your weekly coronavirus town halls. It is refreshing to get straightforward, factual information and answers to our questions. What specific provisions are included in current and upcoming COVID-19 related stimulus legislation that would help cover rent for small business office buildings and offices? Well, again, I would say the CARES Act contains the forgivable loan program through the SBA. And that's specifically to be used for payroll, but can also be used for expenses like rent. And we need more funding, as I said before, ready, willing, and able to take the next flight to go and vote on expanding that funding. We've got to get this done for our small businesses, just like we've got to get more funding done for our hospitals, just like we've got to get more funding done for our states and our cities throughout the United States. So very committed to that. And we've also, got to be very careful that the small business assistance is going to the companies that really need it the most. I was encouraged to get some information just yesterday from SBA on where the money is being lent. And we're going to need more transparency and accountability. Oversight is really, really critical. I think we have time for just a couple more, Doctor. And here's one for you from Craig in Del Mar. What are your thoughts on the likelihood that remdesivir will lessen severity of disease if given early in the disease. A lot of talk about that drug. I think that's from Gilead, right?
Yeah, right. Well, Craig, I don't want to speculate on the results of the trials yet because they're still ongoing. These trials are designed to measure both the desired outcome as well as adverse events. And so there's criteria for both. And so if it turns out that people that are getting the remdesivir are having adverse events at a higher rate than people that are not, they'll stop the trial right away for safety reasons. Or if it turns out that remdesivir looks like it's so much more effective than the standard of care, that could also cause the trial to stop early. So the good news is that the trials haven't stopped yet, which means that that remdesivir seems like it's at least safe. We know it's been used to treat other diseases. It's safe in humans, so we're not so concerned about that. But the amount of data that's been accumulated so far through these trials, which takes time to enroll participants and give them the treatment and then watch to see how they do with the treatment, they're still ongoing. We need a little bit more time to get those trials through the pipeline. So I can't say. The good news is that the trials haven't stopped yet, so they're as far as safety, I think that part's okay, but as far as the effectiveness of the treatment, we still have a little ways to go before we know for sure.
What's your rough guess on when we'll have some therapeutics that will be effective? You think before the vaccine we'll have therapeutics?
Oh, definitely. There's definitely some treatments that are being used. A lot of the treatments that are being used right now or are being evaluated right now were drugs that were already approved for use in humans, but for other diseases like chloroquine, hydrochloroquine, and remdesivir, and some of these other drugs. But we just didn't know if they were effective on patients with coronavirus. Now, in China, where they had the early cases, they were treating people with whatever they could because they didn't have any other options. And so there's some documented cases where somebody might have been given one of these drugs and they got better. And that's great. But what we don't know is, were they more likely to get better with that drug than if they did nothing at all? And so these trials are designed to actually tease that out.
Got it. Francine in Carlsbad asks, I just took a walk on Carlsbad Village Drive, and 90% of the people walking, running, and biking were not wearing a mask. Is there a way to enforce this? Citations. It's just awful that all these people are not following the recommendations. Well, I agree with you that people need to follow the recommendations, and that includes the stay-at-home orders. That includes the recommendations about wearing masks and social distancing, and ultimately it's up to local law enforcement, local officials. But I've spoken with all of our mayors just about in this past week, and I think all of them take these orders seriously, and they know that it's really important if they're going to prevent community spread in their cities, that they need their residents to take these orders seriously. So I would not hesitate if you feel appropriate and serious enough to contact your cities to make sure that if there's something truly egregious going on. Now, I will certainly let our viewers and listeners be the judge of when it makes sense to contact the city versus not. But I think we all need to act with a great deal of kindness and compassion in this time. And part of that kindness is being kind to other people and making sure that we follow the rules so that we don't infect other people. The guidance that I've heard from our public health community now for a number of weeks is act as if you've got this thing, whether you have or have not. At least you've tried to prevent asymptomatic transmission, since we know that a huge percentage of people are asymptomatically transmitting this virus. Anything to add on that one, Doctor?
Yeah, I would just agree with you on that. I think that the key here is that when people are out in public, because sometimes you have to be or just want to be, that the best thing to do is to wear a face covering to prevent the possibility that you might be coughing or sneezing, or even talking can expel the virus, that you're protecting your community members. Now, in terms of how that's being done, I think people can make rational decisions about how to do that correctly. So if you're walking your dog and you're walking down the street and you're in a neighborhood where you're really not going to encounter anybody, and if there is somebody coming your direction, you stay on opposite sides of the sidewalk, or somebody goes out in the street, then wearing a mask isn't really going to won't be necessary. But if you're in a crowded neighborhood where you're going to be passing your neighbors quite often, then I think it would be respectful to wear a mask and to protect other people. And definitely if you're going to be going into a market or going to any place where you're going to be around other people, and it's possible that you'll get within that 6-foot zone, and that's not a magic number, it's a guideline, that it's respect for your neighbors and for your friends that you wear the mask. I think it's the right thing to do. And hopefully you can convince your neighbors to do the same. I hear what you're saying, Francine. I've seen the same in my neighborhood, but I think when we get to that point where we really are being respectful, that's when we're going to be able to start opening up. That's when we're going to be able to go back to the park again. When people, if they go and they actually practice these practices, we can get closer together again safely, but we have to be used to doing things in a different way.
Well said. Last question. We've got time for one more for you, Doctor, from AD in Carlsbad. AD asks, I'm concerned that we are not being more informed about vaccine progress. When will a vaccine be available to the masses?
So that's a really good question. AD, anybody who wants to know the status of these vaccine trials can go to a website called clinicaltrials.gov. It's all one word, clinicaltrials.gov. And you can look up all these trials, not only for the vaccines, but also for all the drugs that are in the pipeline. And so I looked yesterday, and there's currently 37 vaccines that are registered. And but in terms of when they're going to be, the vaccines are going to be available and how much information there is, the trials are in the works, but it takes time to recruit enough individuals who aren't infected, get them tested, get them, vaccinated, and then look to see if the vaccine is safe and has any potential effect. That takes time. And so I know that at least a couple of the trials that are going on now have shown safety, and now they're on to the next phase where they're trying to recruit a larger group of people to look to see if there's actually some efficacy. And then once that happens, then they'll go into the phase 3 trials, where they'll try it out on a much larger population. But this process is designed deliberately to be very careful, because once the vaccine has been approved, then there's going to be a rush to get it out to everybody. And so there could be, if there's unintended consequences of the vaccine, they could be devastating when you vaccinate a large number of people. The other thing is that if it turns out that the vaccine doesn't work, but it does stimulate some immune response that might not be protective, now you might have lost the ability to test people to find out who's susceptible or not. This is a big problem with the developing AIDS vaccines, is that somebody who got the vaccine might always test positive for HIV, even though they're not really positive for the virus, but because they got the vaccine, and the vaccine didn't work, they're not protected, but it's like they have HIV. So it's problematic. We don't want to get in a situation like that again. So trials will take a while. I'm not expecting to see a vaccine available until at least the beginning of next year, maybe longer. But the good news is that at least one of the companies that I read about who's doing these trials right now is at the same time ramping up production, so that if the vaccine does prove to be effective, safe and effective, they'll already have vaccine in the pipeline ready to roll out. So they're not going to start when the vaccine trial ends and then try to ramp up production.
Wow, very cool. Well, Doctor, outstanding job. As always, we're truly grateful. You've got a fan club growing from your appearances at these. That includes me. We're just super thankful. Do you have any closing comments before we wrap up?
I'd just say, for everybody out there, I really appreciate the effort that people are making to try to protect their community members and to, go along with the stay-at-home orders. I know it's hard. We're feeling the pain in our family too, in terms of covering the rents and keeping working. So I feel you, and I just think that this is a very important time in all of our lives, and we can come together as a community to get through this if we all work together.
Well, I thank you again, Dr. Garfien, and I thank everybody for tuning in, whether on Facebook or Twitter or YouTube. We'll be doing these each week at the same time. Until next week, please stay healthy, stay safe, follow those guidelines. And if you have any questions or challenges with regard to any of the programs that we've discussed today, I encourage you to contact our office. You can also visit our website at mikelevin.org, where we've set up lots of resources with regard to COVID. I want to thank Ellen Montanari and our entire team, Adam Berkowitz, Hunter Phillips, everybody that helps make these possible. Jeremy just doing a great job coordinating these video conferences. And until I see you next week, thank you all very much.